If I had to explain psoriatic arthritis to somebody, it's something that you can see on you, but it's also something that you feel. You feel internal pain as well. I first started feeling joint pain mostly in my knees when I was younger. It was pretty much always just in my knees, kind of ankles, legs area. But once I got older, I started getting it in different parts of my body, like kind of back and elbows. So I started feeling it more all over my full body. I mean, one of the ways that psoriatic arthritis really affected me is being active. Not being able to exercise without possibly having a bunch of pain the next day, that's really tough to have to caution yourself from just letting go and having fun. It impacts my work because it can be debilitating day to day. Some days are better than others. Some days you wake up and you don't even want to get out of bed. You don't want to stand in the shower. Psoriatic arthritis affects your focus quite a bit because you're just focused on the pain instead of what you need to be focusing on at work. I had multiple symptoms. I had the joint pain, I had enthesitis, pitted nails, plaques pretty much everywhere. And my whole ears were covered, my eyelids, inside of my nose, my scalp. So it was very much in the first thing you see, and then on my hands. I didn't realize that psoriatic arthritis and my psoriasis were connected until my doctor told me. I had tried multiple creams. I had tried the Light Booth, and I just kept trying all of the things that I could without them working, so I kind of gave up for a while. Cosentyx is the first thing that really worked for me, and I hadn't heard of it before my doctor brought it to my attention. I've been on Cosentyx for almost 3 years. It starts fast and it lasts. I really saw changes actually in the first month. And about 3 months or so, the plaques were already going away. The further I got into it, the more I noticed the joint pain was also dissipating. Now that I feel better, I realize that it's a lot easier to pick up a case of product and put it in my car, grab my computer bag, and do all the things that I need to do. Real relief means to me that I can be closer to people and feel confident in doing that. I'm Jordan. I look and feel better, so watch me.
Indications. Cosentyx secukinumab is a prescription medicine used to treat adults with moderate to severe plaque psoriasis that involves large areas or many areas of the body, and who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet or UV light, alone or with systemic therapy. Cosentyx is also used to treat adults with active psoriatic arthritis and active ankylosing spondylitis. Important safety information. Do not use Cosentyx if you have had a severe allergic reaction to secukinumab or any of the other ingredients in Cosentyx. See the medication guide for a complete list of ingredients. Cosentyx is a medicine that affects your immune system. Cosentyx may increase your risk of having serious side effects, such as infections. Cosentyx may lower the ability of your immune system to fight infections and may increase your risk of infections. Your doctor should check you for tuberculosis, TB, before starting treatment with Cosentyx. If your doctor feels that you are at risk for TB, you may be treated with medicine for TB before you begin treatment with Cosentyx and during treatment with Cosentyx. Your doctor should watch you closely for signs and symptoms of TB during treatment with Cosentyx. Do not take Cosentyx if you have an active TB infection. Before starting Cosentyx, tell your doctor if you are being treated for an infection, have an infection that does not go away or that keeps coming back, have TB or have been in close contact with someone with TB, think you have an infection, or have symptoms of an infection, such as fever, sweats or chills, muscle aches, cough, shortness of breath, blood in your phlegm, weight loss, warm, red or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinate more often than normal. After starting Cosentyx, call your doctor right away if you have any signs of infection listed above. Do not use Cosentyx if you have any signs of infection unless you are instructed to by your doctor. Inflammatory bowel disease. New cases of inflammatory bowel disease, or flare-ups, can happen with Cosentyx and can sometimes be serious. If you have inflammatory bowel disease, ulcerative colitis, or Crohn's disease, tell your doctor if you have worsening disease symptoms during treatment with Cosentyx or develop new symptoms of stomach pain or diarrhea. Serious allergic reactions. Serious allergic reactions can occur. Get emergency medical help right away if you get any of the following symptoms: feeling faint, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing, or throat tightness, chest tightness, or skin rash. If you have a severe allergic reaction, do not give another injection of Cosentyx. Before starting Cosentyx, tell your doctor if you have any of the conditions or symptoms listed above for infections. Have inflammatory bowel disease, Crohn's disease, or ulcerative colitis. Are allergic to latex. The needle caps contain latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Cosentyx should not receive live vaccines. Have any other medical conditions. Are pregnant or plan to become pregnant. It is not known if Cosentyx can harm your unborn baby. You and your doctor should decide if you will use Cosentyx. Are breastfeeding or plan to breastfeed. It is not known if Cosentyx passes into your breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Know the medicines you take. Keep a list of your medicines to show your doctor and pharmacist when you get a new medicine. How should I use Cosentyx? See the detailed instructions for use that comes with your Cosentyx for information on how to prepare an injected dose of Cosentyx and how to properly throw away, dispose of, used Cosentyx Senso-ready pens and pre-filled syringes. Use Cosentyx exactly as prescribed by your doctor. If your doctor decides that you or a caregiver may give your injections of Cosentyx at home, you should receive training on the right way to prepare and inject Cosentyx. Do not try to inject Cosentyx yourself until you or your caregiver has been shown how to inject Cosentyx by your doctor or nurse. The most common side effects of Cosentyx include cold symptoms, diarrhea, and upper respiratory infections. These are not all of the possible side effects of Cosentyx. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.